Modern man gives so much importance to fitness and muscle training nowadays. Doctor, in your opinion, what is the difference between strength and stamina?
Strength means the ability to do the work, and stamina means how much of time you can do the work. That means stamina. It's differ. Each and every person, it's differ.
Yeah. I totally agree with doctor. In order to substantiate that, I would like to add an example here. Okay. See, when you talk about strength, you are putting your muscles to a particular stress. Okay. So, for example, you have a mobile here. I'm putting some stress to lift this mobile. How long I can put my muscles into a stressed position? The time period, that can be considered as the stamina. The number of frequencies for which I can put my muscles to stress, that can be considered as a topic called as endurance. There is a fine difference between these two, which most of the people tend to confuse with. So endurance is something in which the muscles, the number of frequencies where you can put your muscles into stress. How long, the period of time, is considered under the stamina.
But the thing like endurance and stamina, like both are, you told me like a mild difference between the endurance and stamina, is it? So endurance means lifting weight or something like that, like what?
Yes, sir. Strength, I say, that's the confusion here. I say, when I am lifting a weight, my muscles are undergoing stress. So that is my strength. I can lift this particular weight. Okay, this is the strength. Okay, so for example, for 1 minute, I can lift about 10 times. So that is the stress that I am imparting on my muscles. So that is endurance. So after 1 minute, how long I can perform the same job without failing? That is
the same timing.
Yeah, same time, without losing the intensity.
So that's why so if somebody wants to do a push-up, somebody doing push-ups, within minutes, 100 push-ups they are doing, as we said earlier.
Yeah, within 5 minutes.
Within 5 minutes, okay. If they, after finishing the 100 push-ups, again, that's their stamina.
Yeah. The ability to do that 100 push-ups, that's his strength.
Okay.
That 100 push-ups, that frequency, that is his endurance.
Endurance.
If he continues the same thing for a long period.
Yeah, what I'm asking, like after 100 push-ups, if they are stopped for a minute or something, again, if they have started again 100 push-ups in the sense, that's called stamina. Okay.
Yes, that is stamina.
Okay.
Yeah. So, when we consider the strength in Ayurvedic perspective, there is a terminology which we can correlate as called as bala.
Bala.
You see, bala is an umbrella term. When we consider the modern perspective, strength is something which is confined more with the physical or the muscle strength only. So when we consider the Ayurvedic perspective, we consider it as a whole. So that's why I told you in the beginning, it is an umbrella term. Under the bala, there is categories like vyadhikshamatva, in which the ability of an individual to resist against the pathogens, okay? Which we consider as the immunity.
Yeah, immunity.
Then the next is Vyayama Shakti. Vyayama Shakti is that aspect in which the muscle endurance, the muscle part comes.
It's
the physical strength.
Is it exercise?
Yeah, all the relative exercise what a person can do, that comes under the Vyayama
Shakti.
Then you have something called as Sattva Bala.
Oh, okay.
That is regarding the mental strength of the person.
Oh, okay.
So you see, when I tell you that Bala is an umbrella term, under this all these sub-classifications are coming.
Okay.
See, you are talking about the immunity of the person, you are talking about the mental strength of the person, along with that you are talking about the physical strength.
These three are connected.
These three are
connected, yeah.
So that is something that we can impart in as Bala in case of Ayurvedic perspective.
Okay.
So when we talk about the strength is we generally consider as the physical strength. So it is something which the muscles of our body can undertake a particular stress. For example, the ability of my muscles of my arm to lift this mobile. This is my strength.
Yes.
Okay. This can be considered as the strength. This is the force or the stress that I am imparting on my muscles of my arm.
Okay.
How long I can hold this? The time period, that is considered as the stamina.
Okay.
Okay. Within, for example, if in 1 minute I am supposed to hold this in 1 minute, how many times I can lift it again and again? That is the endurance.
Okay. The number of times.
The frequency. That is considered as the endurance. So there is a very slight difference between the strength and endurance part.
Endurance, okay.
Usually people tend to get have a misconception. Okay.
And like already we discussed, like for a person doing exercise, like doing push-ups as an example, we can take. So 100 push-ups they are taking within a 1 minute. That's called their stamina. Okay.
Okay. That is the 100 push-ups that the person is taking. That can be considered as the endurance.
Endurance.
Yeah.
Okay. And after 1 minute, if they are doing the same 100 push-ups, that's their stamina. Okay.
Again, the person can be imparted with a particular stress.
Okay.
That is, he can endure that. That is the stamina.
Stamina.
The 100 push-ups is the frequency, and that acting, that work that he is doing on his muscles, that is the strength.
Okay. But one thing I understand from my practice in the sense, each and everybody's muscle tone is different.
Yes, definitely.
Okay. If I can lift 100 kilo or 50 kilo, in the same like body person, I am like 90 kilos as an example. If we are taking 90 kilos person, I am taking 100 kilos of weight or 50 kilos of weight. But the same weight person can't take that much of weight.
Yes.
So that's the difference is there. So the body weight and the stamina and strength, these three are different.
It is different to individual to individual. It is not same for everyone.
Okay. But regularly, if you are doing the exercises, and we can increase the muscle strength.
Yeah, you can train that.
Yeah, train
your muscles.
Okay. That's exercise side.
So when we consider the Ayurvedic perspective of strength, the stamina, endurance, and all, we collectively correlate it with something called as bala.
Bala.
Okay.
So bala, as I told, it is an umbrella terminology under which a lot of things are compiled together. For example, under the bala, the patient's or the individual's Vyadik Shamatva is considered.
Okay.
Vyadik Shamatva means the ability of the individual to resist against the pathogens.
Okay. The immunity.
Basically the immunity.
Immunity.
That is considered as the Vyadik Shamatva.
Okay.
Next, we can consider the Sattva Bala. Sattva Bala is something which imparts the physical, mental strength of the individual.
Okay.
So you see, the immunity comes in that terminology under the Bala.
Okay.
The next is the mental health.
Okay.
Then comes Vyayama Shakti, the ability of an individual to impart stress over his body or the muscles.
Okay.
That is physical exertion. So you see, as it can, all these are compiled together in the term Bala. So in Ayurveda, all the aspect as a whole. It is not like you are concentrating only on a particular part of the body.
Okay.
You take it as a whole.
And
The entire body, along with the mind. So mind and body connection, both are there.
yeah, that's a very important thing. If a person is doing exercise, so first of all, they should manage their diet.
Yes.
Okay.
Definitely.
So strength and stamina. If you are taking strength and stamina, like three major parts are there. One is diet. Second thing is the exercise, and third is the sleep. Because every muscle needs rest. If a person doing exercise and diet and everything is managing, but he is not getting proper sleep, gradually his muscle got weakened.
Yes.
Gradually the stamina will reduce in the body.
He'll get
So
exhausted.
these three things should connect it. And in a diet side, like nowadays people are very concerned about their diet. Yeah. So in my side, like I'll advise to my patients, youngsters are more focused on consuming protein to like build the muscles, but that's not the proper way. So if you're into diet, it's a combination, a balanced one. It should be a balanced one. One part of protein and one part of fiber and one part of carbohydrate. Why carbohydrate needed? Because carbohydrate is the fuel of the energy. If there is no energy, like muscle will be there, okay, they can do the exercise, but where you get the energy?
No fuel to work.
Of course, you are doing opposite things to the body, so that will happen. Gradually the body will weaken. And nowadays we can see so many people's youngsters, like 17 years, 18 years, 19 years, youngsters, they are more focused on the shape of the body. They want six-pack.
They want a cosmetological.
Cosmetological. They are not focusing on the strength.
No, they are not. Yeah, they are not focusing basically on the physical, healthy lifestyle.
Yeah,
They
that
want
you
a
said.
Photo body.
Yeah.
They
For
want to
social media.
I look like a Hollywood person,
front of the
yeah.
camera.
But nobody is understanding. Like those people, like in film or industrial, they will do this exercise for a particular time,
Yeah.
for 3 months or 6 months.
They are living
A normal life. You know,
yeah.
Hrithik Roshan. For a film, for a film, he managing his body. Okay, the remaining time he's in a normal person and he is taking normal diet.
Definitely.
Understood?
In Ayurvedic perspective also, I totally agree with the doctor, because there is something called as Tristamba. You see, the 3 pillars of Ayurveda.
Okay.
It is under which 2 are just exactly what doctor has told. That is Ahara and Nidra. Ahara is the food or the balanced diet that we take. Next is Nidra. If you just consider, just imagine our body as a machine.
Okay.
Okay, you are putting a lot of stress for the machine to perform a particular job.
Okay.
Similarly, you are putting your body under work. Okay, you are putting all the effort and the body is undergoing stress. The body needs a time to recover, isn't it? If there is a damage in the machine, you keep the machine in a rest mode to repair it, isn't it? You don't keep it functioning. If you have a car, you get it to the workshop and you put it in rust before you repair it, rather than the car is not being repaired while it is running, isn't it? The same way, the body needs the time to repair itself, so that time the sleep is inevitable. That's what I would like.
Ayurvedic medications do you recommend?
Medications, you see, apart from medications are actually we can give as we can consider as
Like a
supplement,
right?
okay? So for everything, for example, for stamina purpose. So when we consider the stamina, the main organ that is involved in imparting the stamina is the heart.
Very
So you can use cardiac tonics. For example, Arjuna Arishta is something that we can use, which is an effective cardiac tonic in case of Ayurvedic perspective. Then you have Ashwagandha. Then you have Draksha Arishta, which is very effective in case of anemic conditions and increases the
Quality of
quality of your blood. So such medications are there. So that has to be imparted after checking the health and after checking the condition of the patient.
But yeah, everybody should go through go through. See, before starting workout or stamina, whatever the things, the daily things, everybody should go through a blood test to find out what are all the condition of our internal organs. So with the condition only we can, the doctor will prescribe the medicine. In Siddha, what we used to give the patients, like as you said, Ashwagandha. In our side, it's Amukura. So Amukura Lekhya is one of the best medicine, and we have one medicine. It's a proprietary medicine of ourselves, like Hriday Shanti. It's a best cardiac tonic I ever seen in my practice. So everybody, but sugar patients, I am not recommending these things because of Arishta kind of things.
We have to look into the blood aspects of the patient.
Yeah.
So undergo checkup first. What the patient is depriving, according to that, we have to give the supplement.
Yeah, so Ashwagandha tablet, Amukura tablet, Amukura Lehya, Hriday Shanti. So those medicines, whatever the doctor prescribing, we don't know the each and every person is different. The health is different. As we said earlier, first they should go through a blood test, do proper things, and first of all they have to understand what are their health.
What I am lacking.
That you can manage. The patient can manage with the medicines.
What about external therapies?
See, external therapies, ancient times, like everybody in our place, like everybody in Kerala and southern part, they used to do weekends. The Monday to Friday, everybody is working. And weekends, they will apply the oil through the body. Okay. And Techuguli. In Malayalam, it's called Techuguli. Okay. So that's.
In Ayurveda, it is called as Abhyanga.
Abhyanga. Now, but nowadays, nobody is applying. Nobody has time and nobody is not applying oil for the head and body. Now they are going to some Ayurvedic hospitals and do a treatment. So that treatment, like Abhyanga Svetana. Okay, that's correct. Abhyanga Svetana is one of the best treatment to rejuvenate the entire body. Okay, for we are doing exercise the day by day, every day. That's why from the Monday to Friday, we are doing exercises. And Friday, Saturday and Sunday, if you are getting time, if you do a proper Techuguli, oil application, so that will relax your muscles. Okay, and improve the blood circulation. And Vayu inside the body, that will manage, and your diet and everything will be in a normal way. So that's the treatment what I'll recommend.
Definitely, I agree with you. When you talk about the Abhyanga, you see, when you put a lot of stress to your body, there is a probability that the cortisol hormone, the hormone cortisol, which is also considered as a stress hormone, can increase in your body. So when you impart the Abhyanga or the Tiruchuli, as doctor said, as the circulation increases, eventually this cortisol level will start to reduce. Which is very, very essential in the mental and physical health of the patient.
Fitness should not be confined just to the physical body. We should include a balanced diet as well as a balanced mind.